Well, good afternoon, everyone. I am Amy Kupal, CEO of the Ontario Caregiver Organization, and I am so pleased to welcome you to our Essential Care Partner Support Hub information session. I would like to begin by acknowledging the Indigenous peoples of the lands that we are on today. While we meet today on a virtual platform with people joining us from across the province, I would like to take a moment to acknowledge the importance of the land which we each call home. As a settler, I am grateful for the opportunity to meet here and thank all generations of people who have taken care of this land for thousands of years. In particular, the land that I am standing on today is the territory of the Anishinaabe, the Haudenosaunee, and the Mississaugas of the Credit First Nations. As team members at OCO, we are learning about the lands from which we work, exploring how we can be meaningful allies, and how we can support the recommendations from the Truth and Reconciliation Commission. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our understanding of local Indigenous peoples and their cultures. The Ontario Caregiver Organization is an independent charitable organization funded by the Ontario government with a focus on supporting Ontario's 4 million caregivers, ordinary people who provide physical and emotional support to a family member, partner, friend, or neighbor. And we provide a wide range of direct supports and services for caregivers. We also work closely with health system partners in ways that recognize the essential role that caregivers play in our healthcare system. Family caregivers are essential care partners and play a critical role as part of the care team. They provide an estimated 75% of care in the system. In today's session, you will learn about a new and exciting initiative led by the Ontario Caregiver Organization in partnership with Ontario Health, the Essential Care Partner Support Hub, that represents an opportunity to transform care and be a part of the solution to healthcare pressures we face today. We know that the last 3 years have been an incredibly challenging time for everyone in healthcare. I want to thank everyone who has joined us for your commitment to providing quality care as these pressures continue and for joining us today. Judy Linton from Ontario Health and I will begin the session by highlighting the importance of care partners and the need for care settings to implement practices that empower and support essential care partners to participate as partners in care. Natalie Mayer will share her experience as a care partner and how being included as a part of the care team has impacted her mother's health outcomes. Lisa Salapatic from the OCO team will explain how the Essential Care Partner Support Hub can support hospitals and long-term care homes across the province. And we are so pleased to have Jennifer Cornell and Paula Doring here to share the positive impact that Essential Care Partner programs have had in their organizations. Now, our session is planned to end at 3:45, and we have a really tight agenda, and we hope to have time for a few questions at the end, so please feel free to use the chat box to ask questions, and we'll gather those along the way. While the evidence in support of care partner presence and inclusion was growing before the pandemic, COVID-19 restrictions uncovered many new learnings about the risks to residents, patients, and the healthcare system when care partners are not able to participate in care. The risks of falls, cognitive decline, behavioral responses, and health decline are higher when care partners are not present. Care partners know the collateral history of the patient or resident, and if they don't have the opportunity to share this knowledge, healthcare workers are lacking important information to support diagnosis and culturally sensitive care. There is also a risk to system capacity. Research has shown that one of the risk factors for ALC is care partner stress, and that lack of care partner involvement in transition planning can increase the risk of readmission. When care partners are not included as a part of the care team, it can also lead to burnout, psychological harm, and increased workload for healthcare workers. So I hope you'll agree there are many compelling reasons to do this work. The evidence is clear. Patients and residents do better when care partners are actively included and involved. And both Paula and Jen will share examples of the positive impact that they have seen within their organizations later on in our session. Throughout the pandemic, the Ontario Caregiver Organization has worked in collaboration with many system partners to help reintegrate care partners after COVID restrictions and build a culture that includes care partners as true partners in care. and we now have a much better understanding of action steps that hospitals and long-term care homes can take, and we are eager to spread and scale this learning across the province. The Essential Care Partner Support Hub, led by the Ontario Caregiver Organization, aims to achieve greater consistency in how family caregivers are identified, included, and supported as essential care partners across care settings in Ontario, with an initial focus on hospitals and long-term care homes. We are ready to support you, learn from you, and collaborate with you as care providers, and hope that this session will be a first step in our work together. I am now pleased to introduce Judy Linton from Ontario Health. We would not be launching the Essential Care Partner Support Hub without the vision, leadership, and support of Ontario Health. And I'd like to say thank you on behalf of all care partners in Ontario and the people that they're caring for. And with that, I'll turn it over to you, Judy.
Thank you very much, Amy. And I just want to say what a pleasure it has been to work with Amy and her team. And we have learned a great deal in the process and really have developed a very strong partnership. So on behalf of Ontario Health and our CEO, Matt Anderson, I'm very pleased to be here today to share information about the launch of the Essential Care Partner Support Hub in partnership with the Ontario Caregiver Organization. We use the term essential care partner because caregivers play an essential role in patient and resident care. When they are included as true partners on the care team, it improves health outcomes and the care experience. Amy spoke a moment ago about evidence demonstrating that care partner inclusion can also help alleviate demands on healthcare workers and hospital usage. Last November, Ontario Health sent a memo to health system partners that included essential care partner programs as one of the 6 key actions to support our collective response to these pressures. We believe that this initiative is important now because it is part of the solution to the pressures we are currently facing in the healthcare system. But more importantly, we believe that identifying, including, and supporting essential care partners is critical for the long term as part of our commitment to person-centered care and better care outcomes. I worked as chief nursing executive in a hospital for the first year of the pandemic, and I saw firsthand the challenges and the distress that was experienced by both patients and by their families and their care partners when they could not be together. And so this is a real opportunity for us to do better as we go forward. While the Essential Care Partner Support Hub will have an initial focus on hospitals and long-term care homes, our long-term vision is to ensure that essential care partners are consistently recognized and included as part of the care team across all care settings. Over the past 3 years, the Ontario Caregiver Organization has worked with many health system partners to enable the safe presence of caregivers during COVID-19. They have gained knowledge and an understanding of successful practices and are ready to share these practices with hospitals and long-term care homes across the province. Our ask to you is that every hospital and long-term care home in the province connect with the Essential Care Partner Support Hub to access guidance, coaching, resources, and knowledge exchange opportunities. We are asking you to think about opportunities to enhance your organization's approach to working with care partners. The team at the OCO is ready to support you and is also eager to hear about successful practices that you have in place that can be shared with others. Thank you very much. Thanks, Amy.
Thank you, Judy, for your words and, of course, for the amazing support of Ontario Health. I am now very pleased to introduce Natalie Mayer, a caregiver who will share her story about the importance of care partners being included as a part of the care team. Natalie, over to you.
Thank you,
I want to
Amy.
acknowledge Natalie has had some technical challenges today with the weather, so we'll just make sure we can hear you, even if it's voice only, Natalie.
You can hear me, Amy?
We can hear you great. Thank you.
Perfect. My name is Natalie, and I'm a caregiver to my son with autism, my elderly grandmother, and my mother with a severe mental health issue. For the purpose of today, I will focus on my caregiving experience with my mother. My caregiving experience began in my late teens when an intensely stressful event appeared to trigger her mania and her bipolar disorder. However, we did not know the diagnosis at that time. All we had seen was her severe depression. My mother has been in and out of hospital at least 10 times. In the beginning, I was caregiving at a distance with her hospitalizations taking place in another city. Every time she was hospitalized for a short period of time with an effort to quickly increase her medication doses to stabilize her and have her return home. It was crucial for me to be able to speak to staff because I was her voice. My mother never talked during her hospitalization because she never trusted any of the teams. Unfortunately, very little communication was had with the team, not for my lack of trying. And every time she would stop taking her medication because she did not like the side effects. In all of these hospitalizations, it was difficult to speak to any staff and provide them with any information that could be helpful or inquire about the plan for discharge. I felt we were seen as an inconvenience and meetings were scheduled to suit the medical team's schedule only. There was one time I was on my way home out of city to get back to work after an extended time away. I asked about expected discharge in order to plan my schedule around this and was told that it wouldn't be until the following week, only to get a phone call informing me that the discharge was happening the next day. So I was on the road during this family meeting. I participated, but was unaware of who was around the table, nor did I understand what the plan was. They had brought in my elderly grandmother, who had previously been a support to my mother at discharge in her younger days, but it was in her late 80s at that point, to take part of the meeting. She could not understand what was being said. She was also hard of hearing, nor did she understand the plan. My mother would again deteriorate, and we would go through the same cycle over again. As a caregiver, the experience with the healthcare system at that time was frustrating, exhausting, and discouraging. One of her episodes brought her to my city. She was admitted to hospital on a 72-hour hold because I had gone to the Justice of the Peace to have the needed forms completed. It was also the time that we met with a psychiatrist that was able to properly diagnose her. He was their first experience with feeling included in her care. A little over a year ago, I moved my mother and my grandmother to be closer to me. My mother was hospitalized again in February 2022 in the height of the pandemic with another acute episode of her bipolar disorder. Even though I was not able to join her in the emergency doctor made a point to call me to get my input and collateral information about my mother. This was followed by a phone call from a psychiatric nurse who kept me informed about next steps. I was then fortunate enough to have my mom connected to an amazing psychiatrist and team who took the time to listen to me and the history I was providing. For the first time, it felt like I was part of the team. The information I shared mattered, and they acted on this information. Because of this, they were able to build trust with her and transfer her to a specialized hospital to provide her even more support. There were questions that were asked, like, who is your mom and what should I know about her? There was some time and care that was put in to ensuring things were done differently and done right. Over the years of caring for my mother and working with the healthcare teams, I have also learned the importance of having a collaborative approach. I was intentional about the most effective ways to communicate my input, the most important information I wanted the teams to know, and the easiest way for the staff to receive it, understanding that their time was also very limited. So for example, I would leave voicemails for one of the care team members with updates of important information that I knew the team needed to know. This collaboration has made a huge difference in the outcome of my mom's last hospitalization in a very positive way. This time, my mother was discharged home. It was different than previous hospitalizations because there were supports in place. She was taking her medication after discharge, and she has been home and doing well for over a year now. She has been better than she's ever been in 20 years, and this is not something I've ever seen before. This experience felt like a huge step forward in her care. This is the type of caregiving experience that should be the norm. I have seen it, and I continue to be hopeful that we are moving towards a healthcare system that includes caregivers as part of the team. I do believe that there are champions in our healthcare system, and there have been positive changes. It is my hope that the Essential Care Partner Initiative will help create more of the same positive experience for patients and caregivers throughout the province. I thank you for taking the time to listen to my experience.
Natalie, thank you so much for sharing your experience. And we value so much the voice of caregivers, but we understand that it is a personal labor that you do to share your story. And we're so grateful for you taking the time to do that in terms of your experience and your perspective. Now I'd like to introduce Lisa Salapatic from our team at OCO. Lisa will provide more information about Essential Care Partner programs and how our Essential Care Partner Support Hub can help. So over to you, Lisa.
Thanks so much, Amy. And I wanted to echo your thanks for Natalie. You bring this topic to life like no one else can. And thanks as well for making the extra effort to join us, even though you had some issues with the storm and how it impacted technology today. So thank you. I'm going to start by taking a look at how Essential Care Partner programs have evolved over time. Thinking back before the pandemic, there was growing recognition of just how important caregivers are. We began to see hospital policies allowing 24/7 family presence. We saw an increasing number of care settings who began to really focus on building stronger relationships with caregivers and families. And then COVID came along. As Amy highlighted, COVID restrictions led to a whole new wave of evidence and some very difficult lessons on what happens when caregivers are not able to participate in care. The term essential care partner emerged during COVID. After initial restrictions, long-term care policies were introduced to help ensure that care partners could be there for their residents. At this time, the Ontario Caregiver Organization launched a learning collaborative to support early adopter organizations who were welcoming back caregivers with their own essential care partner programs. You'll hear from two of them shortly, Jen and Paula, and they'll talk about how meaningful caregiver inclusion really does bring rewards. As we continue to face high-pressure times in the healthcare system, now more than ever before, there's a need for new practices and culture change. Essential care partner programs are not simply a response during times of crisis. They're needed for the long term as a really critical part of our shift to more person-centered care. When we refer to essential care partner programs, people often assume that we're simply talking about policies on who's allowed to enter a care setting to support a patient or resident. But it's really about much more than that. While enabling unrestricted access is important, essential care partner programs are also about what happens when the care partner is in the care setting. These programs have three key areas of focus: identify the caregiver, include the caregiver as part of the care team, which Natalie spoke so well to about what that looks like a moment ago, and support the caregiver. I'm going to highlight a few of the leading practices relating to each of these areas of focus based on our learning from hospitals, long-term care homes, health system partners, and care partners that have been engaged in this work with us over the past 3 years. I'll start with identify. Essential care partners are identified by the resident or patient or their substitute decision maker. Their role can vary depending on what's important to the patient or resident, as well as the abilities, the availability, and the willingness of care partners. Assisting with meals or facilitating communication for someone who doesn't speak English often come to mind first when we think about these types of caregiving tasks that might be associated with an essential care partner role. But social, emotional, and spiritual support can also be essential to the health and the care experience of residents or patients. We've seen many examples of organizations who are taking a proactive approach to really encouraging residents and patients to identify their essential care partners upon admission or even before admission. Formal identification with a caregiver ID badge is also considered to be a leading practice and a really tangible way for an organization to demonstrate their commitment. The badge can help facilitate better communication between staff and care partners. And I've heard from so many caregivers about the sense of pride they felt when they received an ID badge and their role as a caregiver was recognized and validated for the very first time. One of the key takeaways from COVID-19 is the importance of crisis-proofing policies so that residents and patients are never again left without the essential support of their care partners. But including caregivers as part of the care team means so much more than that. And again, as I listened to Natalie, I was thinking about the value of really simple questions like, who is your mom and what should I know about her? This can really change health outcomes. Staff education and training are important so that all staff understand the program, the important role of care partners, and how to communicate to support better care. Integration of essential care partners at the point of care is an opportunity for better patient and resident outcomes. Planning for care transitions and hospital discharge are really great examples of times in the patient journey when care partner inclusion is really critical. It can mean the difference between a successful transition or one that leads right back to hospital readmission. When it comes to including care partners in conversations about care, we often hear from providers who are concerned about health privacy, and those concerns are very valid. OCO has developed resources that can help providers to understand health privacy and consent rules so that they can work together with care partners as part of the care team while respecting patient privacy and consent. The last thing I'll speak to is the element of supporting the caregiver. And while so many care partners feel that their role is rewarding, they do need support. Onboarding and orientation is an important part of essential care partner programs to ensure that organizational policies and processes, such as current IPAC measures, are understood. Clarity and good communication can also help establish a foundation of mutual commitment between care partners and staff. Care partners may also need guidance or training to help them with specific caregiving activities. We know, and you know, that many healthcare workers are facing stress and burnout. This is also true for caregivers. When caregivers are burnt out, it can impact their ability to continue in their caregiving role. This in turn places more pressure on the healthcare system. Amy shared earlier about the fact that caregiver stress is actually one of the risk factors for ALC. But supports are available to support the well-being of care partners, including programs and services like the Caregiver Helpline offered by OCO. Providing linkages to these supports is also an important part of essential care partner programs. And the last thing that I'll be covering off today is a brief overview of the Essential Care Partner Support Hub. We are here to support implementation. Our initial focus is on the hospitals and long-term care homes with planned expansion to other care settings moving forward. And OCO is currently and very open to working with many of those care settings as part of our core work right now. But for the Support Hub offers guidance and coaching through a dedicated staff team. We also offer information about leading practices based on organizations that have successfully implemented, and I've talked about some of these leading practices today. Resources and tools, including implementation guides and adaptable templates, these can be found on the Essential Care Partner Support Hub website. And opportunities for education and knowledge exchange. Our goal is to make it as easy as possible. Long-term care homes and hospitals that have been part of our learning collaborative have told us that having the opportunity to connect with others and adapt existing resources has enabled them to implement faster with much less effort. Others indicated they were able to find solutions to the road bumps they faced along the way as a result of those connections. We're here to support you, but we also want to know about the work that you're doing in this area because we know that there's a lot of great other examples of essential care partners out there that we're not aware of yet. We're eager to hear those so that we can share success stories, tips, and resources with others. I am now very pleased to introduce Jennifer Cornell, who is the Director of Long-Term Care with the County of Grey. Every time I hear Jennifer speak, and I've had many opportunities to do so, I am so inspired by the approach they've taken at Grey County. So I'll pass it over to you, Jennifer. Thank you.
Great, thank you so much, Lisa. At our 3 long-term care homes, so Grey County operates 3 long-term care homes. Over the past 3 years, we have formally onboarded over 500 designated care partners. And while our initial work was inspired by dealing with the restrictions that came with the pandemic, our vision has evolved to be that by including designated care partners as part of our care team, we're creating the path to truly person-centered care, emotion-based, relationship-based care. Staff recognize and understand the importance of families and care partners. They always have over the decades. This program, though, allows us to formalize it and provides the tools and resources to support both the designated care partners and our team members in our homes. We all know that the staff-family member relationship is not always an easy one, and we find that the DCP program really helps with this. Often the person with the most concerns is the person that has the most worries and the most fears and can be the fiercest advocate. And when they're included in the team, when they're included in the conversation, they become part of the solution. They become part of the team that's problem solving, coming up with interventions, rather than pointing out concerns or voicing complaints. And in many cases, this can reduce the contention and conflict that can arise in these really emotionally charged situations. This partnership is our path forward to person-centered care, and it allows us to tailor to each individual the care and support that we provide. And Natalie did such a beautiful job of describing that. Who knows the resident best? First of all, the resident. And when the resident can't speak for themselves or has asked for someone to support them, it's that person that the resident identifies, not always a family member, sometimes it's a close friend. Those people often hold the key information and insight into what's going on with the resident. What interventions might de-escalate a situation? What will improve their quality of life and their overall well-being? And Paul is going to speak to this in more detail. Essential caregivers has also become legislated in our long-term care legislation. But the designated care partner program or essential care partner program, whatever nomenclature you use, it moves us from compliance to a culture change. And we all know that in culture change, checking a box is often not enough. We do this work because it's the right thing to do. It's an investment in person-centered care. And when we talk about culture change, we know that it takes time, and it also takes resources, training, knowledge exchange. We leaned heavily on our partners across the system who were also doing this work. The Ontario Caregiver Organization, the Learning Collaborative, the CLRI Research Project, Healthcare Excellence Canada. We all together supported each other. They supported us during the pandemic and into the future. It's a good reminder that we don't have to create and implement these initiatives alone. This program makes a difference for residents and families and also makes a difference for our staff. Caregivers are absolutely a part of the solution. And throughout the pandemic, I regularly said that if we were fueled by gratitude alone, the feedback from our DCPs and our residents would see us through. And in the words of Dr. James Conklin, who is the researcher that we worked with on a research project about essential caregivers, he says, this should be obvious, but it needs to be said, essential caregivers are essential. And in the words of Janet, one of our designated care partners, it's magic, it's connection, it's life, and it's love. And that's the value of a DCP program. We continue to work intentionally to embed our designated care partners in our care team and the day-to-day care and operations of our home. It's an ongoing evolution, and I'm so pleased to be part of what I believe is the future of great care in not only long-term care, but across the spectrum of care. And thank you for having a chance to be a part of this discussion.
Thank you so much, Jennifer, for your truly inspiring words and for your ongoing commitment to including care partners in your long-term care homes. I think these real-life examples are what bring this all to life, and we appreciate you taking the time to share with us. Now, I'm very pleased to introduce Paula Doring to share her experience with the Designated Care Partner Program at Briere Continuing Care. Paula, over to you.
Thanks very much, Amy. Natalie, it was heartwarming to hear your story about your most recent experience and the level of engagement that you had with the healthcare team. That is absolutely terrific. And Jennifer, you nailed it. It takes a culture shift, but it also takes leadership commitment in the organization to ensure that a care partner program can move forward. So thank you very much for the opportunity this afternoon to share Briere's experience with our Care Partner Program. I'll just start by saying there are many organizations that are going through accreditation right now. We had the Accreditation Canada survey team at Briere last week. And one of the first questions they asked was, what is one of the most significant accomplishments, or what are one of the things you're most proud of that you've had over the last couple of years and during COVID? And the top of my list was the Designated Care Partner Program. You will hear me refer to it as the Designated Care Partner Program because when we started the program, that was the terminology that we used, and we have continued to use that thus far. You know, I along with many others, I think, believe that our Care Partner Program was a lifeline during COVID. And in many instances, you know, they were the eyes, the hands, and the ears that were at the bedside while staff were tied up in other patient rooms in full PPE. They continuously came in. Our care partners were there to help assist in feeding, helping with activities of daily living, keeping an eye on their aging family member who were at risk of falls. So they were there helping us prevent those slips, trips, or falls that we know happen on a daily basis. They were the communication conduit for the family members. But most importantly, they helped us deal with the isolation and the loneliness that our patients and our residents were experiencing. Today, we're 3 years out, and we're still realizing many benefits and new benefits of our program. Healthcare continues to struggle. As Judy mentioned, consistent staffing levels are difficult for many of us in our clinical areas. Some units are working short-staffed every day. Our volunteers have not returned as we had hoped they would. They're not there in the same numbers. But what has remained constant is our care partners. They have been unwavering, reliably supporting our patients' care and their emotional and their social needs. We as an organization have recognized their value at the bedside and at the care team level. Let's face it, I think that Natalie mentioned, and Jennifer, nobody knows the patient like the patient themselves or their family. I've had the pleasure of witnessing some of the care partners grow in their level of confidence in the environment. Healthcare can be very stressful and it can be very intimidating, but being a vital part, an integrated member of the care team, some of our care partners have really moved on and they've become members of our Patient Family Advisory Council. One of them actually became one of our board members. So he's on our Briere board of directors. So people have gained confidence and an understanding of healthcare that they felt they could contribute at a broader scale. It has been a real pleasure to witness some of their personal growth. They're now sharing, as I said, their knowledge with other care partners and at the organizational level. I believe they truly feel valued and they have a purpose. Some of our patients that have a longer stay, like our complex patients, those patients that require long-term ventilation, or our ALS patients who are now nonverbal, our care partners have become their voice. We see the value, their expertise and knowledge about the patients and their needs. They've helped us build routines into patients' care. They've worked together with the staff, the physicians, the allied health professionals, building those routine care plans and around the patient's goals of care, not ours, the patients and the families. This makes it much easier for our staff to provide person-centered care. That you cannot put a price tag on. Thank you very much.
Paula, thank you so much for sharing your experience. And I think you really built on the real life experience that both Natalie and Jennifer shared by highlighting things like the changes in the engagement of volunteers and the longer term benefits of working with essential care partners. So thank you so much for taking the time to share your experience with us. I also want to say a huge thank you to all of our speakers, in particular, Paula, Jennifer, and Natalie. Your lived experiences and your perspectives are honestly invaluable, and I hope the people who are on with us here today agree. Now, we do have a few minutes for questions, so if you have not yet submitted a question in the chat box, feel free to do so. We may not have time to answer all of your questions, but we will provide a summary of responses to the frequently asked questions in a follow-up communication. And I see that my colleagues are jumping on here so that people are ready. Now, we do have a couple that we're ready to explore first and invite people to continue to submit. So the first question that I have is, how were you able to implement your designated care partner program given time and resource constraints? And I wonder, Jennifer, if you can take this one on, kick us off.
Sure, thanks. And it is a great question. And like many of you, if you look back, you think, how did we do that? But really, it was a team effort. It was a shared vision. So it wasn't like trying to sell an idea that people weren't looking forward to, that they weren't invested in. This actually, a lot of the push to find some other solution to allow people to safely be at the bedside came from the team members providing the care and support in long-term care. So it was a shared vision. It was a team approach. Some of the logistics that really made it work, though, was having a lead on site. So someone, a manager or a leader on site who was committed to kind of coordinating and pulling things together. And then it was through the resources and support of the Learning Collaborative, shared resources from partners doing similar work. Hotel Dieu Grace were early collaborators and were very willing to share all of their information, and then we were able to adapt it to long-term care. So it's one of those cases, I think, of short-term, really intense investment in time and resources for a long-term gain. And then Paula spoke to that really clearly, where we needed the support of our designated care partners, particularly during outbreaks and staffing shortages. So it was short-term investment of time, but then just paid off over and over and over again.
Thanks so much for your perspective on that and sort of highlighting the complexity. Now, we do see some other questions coming in. I don't think we will have time to cover all of them today. However, we will, as I mentioned, compile those, and we're seeing questions coming from different vantage points. So we'll make sure that we can put together some frequently asked questions and send those out. Let's look at this question, though, and Paula, I'm hoping you might be able to chime in on this. How did you ensure your care partners were prepared for their role, and what did this entail?
That's a great question. When we first started, we actually offered educational sessions on the weekend. This was during very early times during COVID. And we shared a lot of information, broad information about Gruyere, but also information about infection prevention and control practices. We shared with them how to don and doff PPE. We issued them their ID badges, but we had a group of designated care partners together so they could ask questions of one another. Now we've moved to our education is online. So people can go on the website and watch some of this. And if we do have areas where family members or friends still need to be trained on how to put on a mask or gown, we do that at the bedside. And our frontline staff have now been more engaged. To begin with, it was one individual, our spiritual care director, who really embraced this program. Now we see that many of our frontline staff are happy to take on and educate some of those families at the bedside. I'm not sure I answered all that question, Amy. What was the other part of it? Sorry.
Yeah, I will repeat the question and then you can see if you have other nuances to add. How did you ensure your care partners were prepared for their role and what did this entail?
So through that educational session, we told them what they can do and what they can't do. And if there were questions, so for example, can I feed our parent if they don't have any difficulties, with feeding and they can swallow? Absolutely, you can move forward. Don't do something independently where you may need some help. So don't lift and transfer on your own. And we had a little bit of brochure for them. So there wasn't really any confusion, I would say, about what they could or couldn't do. And we asked them to be very forthright and followed up with us. And we would send emails out to our DCPs on a regular basis, sharing information with them if we wanted to broaden their scope or share information from the Briere perspective that we might have an outbreak on this unit to be prepared for. So we communicate with them very regularly.
That's great. Thanks so much, Paula. And I think this is a great starting point to this conversation. Now, we've only got a couple of minutes left. So Lisa, I'm going to ask you to be very brief in your response and we can follow up in more detail. But we have a question about how are ECPs supported? Do they receive meals, coffee, parking passes? Let's just do a highlights of that and then we can always follow up with more detail as well.
Thank you, Amy. This is one that really can vary across settings. I have heard of parking support for ECPs, although that's not necessarily something that exists in every care setting. There is one hospital that has actually set up a caregiver kind of office space that they can use if they are caring for someone who's in the hospital but might need to take some time off to cover off their business needs as well. So many interesting ways. I think the in-setting support is one aspect of it, but also, as I mentioned earlier, there's supports that caregivers need just for understanding kind of the onboarding and the experience about their role as a caregiver, as well as where they can go to for support if they're experiencing stress and burnout, because caregiving can be a difficult role. So I'll leave it there to be brief, and we can elaborate on that in our follow-up communications.
That's great. Thanks, Lisa. And we've seen a number of really great and diverse questions coming in this Q&A period. If you haven't submitted your question yet, please feel free to do so in the next couple of minutes as we're wrapping up. We will compile these and share out the common questions and answers. And what I find quite striking about the questions that are coming in is how people are looking at this from a policy, a practice, a practitioner, and a caregiver kind of perspective. So we'll make sure in our follow-up with you that we cover off all of those themes and vantage points as well. But as we come to the end of our time together, I really want to invite you to continue this conversation within your organizations and of course with us as well. Think about adding essential care partner programs as an agenda item on your next leadership meeting and decide who could take the lead on this moving forward within your organization. Please, of course, let us know if you have success stories or resources that we can share with others. And if you need help as well, that's what we're here for. As a follow-up to today's session, I encourage you to reach out to our team to set up an introductory meeting and to check out our Essential Care Partner Support Hub website. And I also invite you to join us for future events that you can see listed here. We'd love to see you at these events and also to receive your feedback on other events or topics that you'd like to see us cover in the future. We will send you information to share with teams so that you can learn more about our tools and resources and also become engaged in our Essential Care Partner Learning Collaborative. Thank you so much for spending your time with us today, for your thoughtful questions and your insights. Thank you again to all of our speakers and to our amazing OCO team members who've been working in the background to make sure that everything goes smoothly, and wishing everyone a great day. Thank you so much for coming to today's session.